Birth weight doubles by 5 months and triples by 1 year. Birth length doubles by 4 years. Head circumference equals chest circumference at 1 year. Anterior fontanelle closes by 12 to 18 months. Posterior fontanelle closes by 6 to 8 weeks. First tooth eruption equal lower central incisor at 6 to 7 months. Permanent teeth eruption starts at 6 years. Average weight of 1-year-old is 10 kg. MUAC used for screening malnutrition in 1 to 5 years. Pincer grafts develops at 9 months. Exclusive breastfeeding recommended till 6 months. Pincer grasp matures at 12 months. Colostrum is rich in IgA and protein. Complementary feeding starts at 6 months. Vitamin K at birth prevent hemorrhagic disease of newborn. PEM types kwashiorkor equal protein deficiency and marasmus is calorie and protein deficiency. WHO growth chart is standard for growth monitoring. Severe acute malnutrition is MUAC less than 11.5 cm. Rickets due to vitamin D deficiency. Scurvy due to vitamin C deficiency. Beriberi due to vitamin B1 deficiency. Apgar score taken at 1 and 5 minutes. Normal newborn weight 2.5 to 4 kg. Low birth weight LBW is less than 2.5 kg. Very low birth weight VLBW less than 1.5 kg. Extremely low birth weight baby is less than 1 kg. Kangaroo mother care is for LBW babies. Vernix caseosa, white cheesy substance. Physiological jaundice appears after 24 hours. Pathological jaundice appears within 24 hours. Neonatal resuscitation initial step is dry, warm and stimulate the baby. BCG given at birth, intradermal and in left arm. OPV 0 dose at birth, subsequent doses at 6, 10 and 14 weeks. Pentavalent vaccine is DPT, hepatitis B, HIV. Measles vaccine first dose at 9 months. MR vaccine at 9 months and 16 to 24 months. IPV, inactivated polio vaccine, IM injection. DPT booster at 5 years. Vitamin A prophylaxis, 1 lakh unit at 9 months, then every 6 months till 5 years 2 lakh unit. Rotavirus vaccine given orally at 6, 10 and 14 weeks. JE vaccine given at 9 months and 16 to 24 months. Most common congenital heart disease is VSD, ventricular septal defect. Cyanotic heart disease is TOF. Tetralogy of Fallot. Ductus arteriosus closes at 12 to 24 hours. Rheumatic fever commonly follows streptococcal throat infection. Cleft lip repaired at 3 months, cleft palate at 9 to 18 months. Hydrocephalus is excessive CSF accumulation. Meningitis diagnosis, CSF analysis. Most common cause of seizures in children, febrile seizure. Nephrotic syndrome, edema, proteinuria, hypoalbuminemia, hyperlipidemia. Acute glomerulonephritis follows streptococcal infection. Measles, Koplik spots are pathognomic. Mumps, parotid gland swelling. Rubella, dangerous in first trimester pregnancy. Chickenpox, dew drops on rose petal lesions. Diphtheria, pseudomembrane in throat. Pertussis, whooping cough. Polio, flaccid paralysis. Tuberculosis diagnosis in child, gastric aspirate. Hand, foot, mouth disease, Coxsackie virus. HIV transmission most common cause in children. Perinatal transmission in children. Iron deficiency anemia is most common in children. Thalassemia is a genetic defect of hemoglobin synthesis. Hemophilia. Deficiency of factor 8 is hemophilia A and deficiency of factor 9 is hemophilia B, ITP, immune thrombocytic purpura. Leukemia, most common in children ALL, acute lymphoblastic leukemia. Wilms tumor, renal malignancy in children, retinoblastoma, malignancy of eye in children. Sickle cell anemia, defect in beta globin gene. Bone marrow biopsy is the confirmatory test for leukemia. Heme arthrosis is common in hemophilia. Moro reflex disappears by 4 to 6 months. Rooting reflex disappears by 3 to 4 months. Palmer grasp reflex disappears by 5 to 6 months. Plantar grasp reflex disappears by 9 to 12 months. Babinski reflex disappears by 12 to 18 months. Primitive reflexes, persistence beyond age, neurological disorder, Down syndrome, mongoloid facies, CV increase, mental retardation. Autism, impaired social interaction, repetitive behavior. Cerebral palsy, non-progressive motor disorder. ADHD, inattention, hyperactivity and impulsivity. Group, barking cough, inspiratory stridor. Epiglottitis, caused by Haemophilus influenza type B. Bronchiolitis, most common cause RSV. Pneumonia diagnosis, chest X-ray. Foreign body aspiration, most common site, right bronchus. ARDS, respiratory distress plus hypoxemia, not relieved by O2. Surfactant deficiency causes RDS in preterm infants. Chest indrawing is a sign of severe pneumonia. Wheeze is a hallmark of asthma. Pulse oximetry is used for detecting hypoxemia. First social smile appears at 6 to 8 weeks. Stranger anxiety appears at 6 to 8 months. Toilet training usually achieved by 2 to 3 years. IQ less than 70 indicates mental retardation. ADHD most common in boys. Accidental poisoning most common cause in children. Kerosene oil. Toilet training usually achieved by 2 to 3 years. Most common cause of death in under 5 children in India is pneumonia and diarrhea. Oral rehydration solution ORS discovered by D.N. Nalin and R. Cash. Dehydration best assessed by skin turgor and sensorium. Under 5 mortality rate बेस्ट मेजर ऑफ चाइल्ड हेल्थ स्टेटस। अगर आपको ये वीडियो यूजफुल लगा तो वीडियो को लाइक कर दीजिए और चैनल को सब्सक्राइब करना ना भूलें। अगले एपिसोड में हम बात करेंगे कार्डियोवैस्कुलर सिस्टम के 100 वन लाइनर्स के बारे में।